Okay.
All right, my name is Anthony Nuccio, and this is the strategic audit for ADO Health Services. ADO is a 30-year-old multidisciplinary practice specializing in pain management, mental health and addiction, and reference laboratory services. They are located in Youngstown, Ohio, with a satellite location in Warren, Ohio that strictly services pain management. There are a few factors that ADO needs to consider for their external environment. South is a large competitor that is opening a new pain management practice 10 minutes away from ADO. They have an established imaging center and outpatient hospital that receives very high awards and patient satisfaction scores. Bundled reimbursement bring a lot of uncertainty to ADO. There's not a lot of clarity on how specialists will be affected by the bundled reimbursement. Current Medicare and Medicaid population in Youngstown has not changed much in the last few years. However, the reimbursement per patient has dropped just over $100. ADO has approximately 70% Medicare and Medicaid patients at the pain practice. Currently, ADO has about 30% market share for their pain and addiction center. In 2013, ADO's net revenue was $4 million. In 2016, when the reference lab was running CareSource specimens, their net profit climbed to $35 million. 2017 was expected to top $50 million. However, ADO lost their CareSource contract and can no longer run CareSource samples. It is set up as a for-profit S corporation. Dr. C. Neuendorf is the owner and president. As you can see from the org chart, they have a very thin management team. 2 years ago, they had an additional 3 positions at the C level, and these individuals have left, and the owner decided not to replace them at this time. ADO has some great strengths and opportunities. They are well diversified with the 3 disciplines of pain, mental health, addiction, and laboratory services, and they have received fantastic customer service scores, especially in their pain practice. With the current opioid crisis, they have the opportunity to fill their addiction center, which has a capacity of over 400 patients. Currently, they are averaging 40 patients. The growing elderly population also presents an opportunity to grow the pain management center. Their current weaknesses include the loss of the CareSource contract and the lack of strong leadership team. Their thin approach to management is causing mistakes and oversights to occur. Finally, ADO needs to consider the threat that Southwoods will pose. They need to remain cognizant of the threats of other addiction treatment facilities in the area, including Neil Kennedy and Meridian Services. Strategic alternatives for ADO include ramping up the social media and websites to remain competitive and reach the correct demographics, especially for the addiction center. Other advertisements for the addiction center should include billboard and meeting with drug courts, ERs, police departments, church groups, etc. They need to quickly add more sales staff to the laboratory and gain market share of the non-CareSource specimens. ACOs, MCOs, and hospital partnerships could also present an opportunity to grow the practice. Having contracting skills and power affiliated with ACOs and MCOs could help ADO receive maximum reimbursement for the services rendered. In order to quickly implement the social media and website initiative, I would recommend that they outsource this function to a marketing company. This could be performed quicker by an outside firm, and ADO does not have the current marketing manager position filled. Billboards seem to be very popular for advertising addiction services, and I would recommend that they reach out to a billboard company like Lamar to optimize their time and resources. Adding sales staff to the laboratory can help push the samples there faster, and cold calling these sales reps and setting up meetings can help onboard these individuals in an expedited fashion. The implementation phase, understanding the improvement through key performance indicators or KPIs, is important to guarantee positive momentum. This scorecard is a quick example of how measuring the percent increase in volume for patients in the pain practice or samples in the laboratory can illustrate if initiatives are working. The charts below offer a graphical representation for easy interpretation.
Anthony, it's Wendy. Is the lab adequately staffed with both instrumentation and associates for the amount of extra work that could be coming if the strategic plan were put in place?
It is. Prior to losing the CareSource contract, the laboratory was running anywhere between 30 and 50,000 specimens a month, and volume was comprised 90 to 95% of the CareSource contract. So they have a tremendous capacity that's left unfilled currently.
Okay, thanks.
Anthony, could the company partner with different hospitals and help reduce readmissions for addiction, crisis, and ER visits and admissions at the hospital, and partner kind of with hospitals to help reduce readmission?
Certainly, the counseling center is equipped to handle addiction patients, and relapse prevention as part of the curriculum that is taught at that facility. So that should, help those patients not re-enter that hospital system, with overdoses and what have you. Other questions?
Problems such as loss of contracts.
Was recording started again?
Yes.
Okay. Yes, having the proper management could definitely help renegotiate contracts that are already in existence. For the CareSource contract specifically, there's no hope that they will ever get that back. CareSource has put very strict rules in place regarding who and how contracts will be given in the future, and ADO will no longer qualify for that. So as a whole, I believe that it would definitely help the organization to have more leadership to negotiate contracts they already have today.
So this is my strategic audit simulation project for Doctors Hospital and Ohio Health Laboratory Services. Doctors Hospital is a nationally recognized not-for-profit charitable health care outreach of the United Methodist Church. Their mission for Ohio Health and Doctors Hospital is to improve the health of those we serve. Ohio Health Laboratory Services mission is guiding care, lab results, guide physicians to make their decisions. Ohio Health Laboratory Services is currently 6.3% per test budget under, performing tests annually of 9.5 million. Doctors Hospital is a testing facility for the Ohio Health Corporation. They are in the process of testing a state-of-the-art monitoring system for patients called eCompanion. For corporate governance, the board of directors for Ohio Health makes all the organizational decisions for all the sites. The Ohio Health Doctors Hospital has a president, a vice president with chief nursing officer, a vice president of finance, and a vice president of medical affairs. Ohio Health Laboratory Services leadership has a system vice president that reports to the VP and COO and the CEO, and 3 system directors report to her with support services underneath them. Ohio Health Laboratory Services has a direct relationship between the senior director of Ohio Health Laboratory Services and the vice president of business development and service lines at Doctors Hospital. The external environment, the most important stakeholder is the patient. Ohio Health and Doctors Hospital look at the community of the west side of Columbus. They try to forecast the services lines that are needed at Doctors Hospital, and they have challenges with literacy and language barriers due to the culture that in the areas surrounding the hospital. Initiative at Doctors Hospital, the Vice President of Medical Affairs goes out to see patients in the community that have been discharged to make sure that they understand what they need to do to recover. Our patients in our community would rather come to Doctors Hospital than go to the big city hospital, even though they're in the same network. The external opportunities and threats for Doctors Hospital and Ohio Health Laboratory Services. Opportunities, we have new technology, economic factors, and stakeholders, meaning our patients. Competition would be a threat, along with stakeholders. I also put that one as a threat. Internal strengths and weaknesses. Ohio Health Laboratory Services are well known to their customers or patients for accurate and timely results, courtesy and knowledge, and dedication to serving the patients. Their weaknesses: cost structure is higher than those of our competitors. Strategic alternatives, long-term goals, quality and affordability. Will provide growth for Doctors Hospital and for Ohio Health Laboratory Services. Cost structure and cost savings, looking at areas to cut costs and implementing new procedures to do so. For implementation, quality and affordability, the timetables are in place for implementation of different programs. Kronos is one of those programs. What's needed is more information for the associates. Information's not always given at the meetings. There's a negative impact on a process that isn't in play yet. This change will be a positive one for everyone. For new technology and clogging in and out, everything in one place, and it's all electronic. And evaluation and control, we have change agent meetings that we get the information in. We've given pulse surveys for associates, so they can understand to see where they're at in the process. The measurement of success reports built in Kronos for managers to pull to see how the associates are progressing. And for recognition, we have an Inspire program, which is a new program where you can build points and get gift cards in return. My strategy assessment and its alignment with the organization's mission and vision. Ohio Health's vision is where people want to work, where physicians want to practice, and most importantly, where patients want to go when they need healthcare services. Ohio Health Laboratory Services wants nothing more than to serve our patients to the best of our ability every day. Some of the strategies I put forth fall under the Quality and Affordability Workforce Initiative to control costs and gain associate satisfaction. With the new program, Kronos, associates will be able to handle all their vacation, sick days, and clocking in and out from a mobile device. Ohio Health is on track to save $96 million for the fiscal year 18, and the whole process spans 5 years with a cost-saving goal of $200 million. Any questions?
How are they planning on cutting and saving $96 million for 2018?
The quality and affordability has like 3 phases in it. Currently, we're in phase 2. And there's 12 different sections that provide cost savings. One of the ones that was in phase 1 was for nursing. They now sign up for shifts. They are not assigned shifts. So it cut costs with overtime and helped with morale.
Hi, Wendy. So if employees are able to do everything from their mobile device, does this pose a risk to the healthcare facility that patient or that employees will be clocking in from home or on the road on their mobile device and kind of allow some discrepancy in clock in times and being able to access all that from different devices and not within the facility?
I don't think so. We'll find out when we go live with it. But currently, they're telling us that you have to be within the building to clock in from your phone. You can also clock in from computers, the base on the wall, and from the telephone.
Have you considered solutions to improve communication with patients who speak little English?
Yeah, the Vice President of Medical Affairs that goes out has a team that goes with him that has an interpreter with them to help them understand the directions.
Buckenroth. In tonight's presentation, we will take an in-depth look at Five Rivers Health Center and propose a strategic plan that will help achieve new goals for expansion and profitability. We will discuss the planning process to manage the development, implementation, and evaluation of strategic plans. Five Rivers Health Center is a sovereign, not-for-profit organization delivering comprehensive primary health care to individuals and families who are principally inhabitants of Dayton, Ohio. Five Rivers is a FQHC medical facility or federally qualified health center, which are community-based organizations that provide comprehensive primary and preventative care to persons of all ages, regardless of their financial standings. Their financial performance is determined by the grants and contracts, federal grants, donations, items like services and supplies, reimbursements from private and public insurance, and monies received from copays and support revenues or revenues received from Premier Health Partners, which offsets surgical follow-up or transitional care, outpatient visits driven to reduce hospital reentry. Partnerships with Premier Health Partners and Wright State University's Boonshoff School of Medicine are extremely important to the health center as they are resident-operated clinics. Medical school residents donate their time to work at the center. FRHC operates their healthcare organization in accordance with the patient-centered medical home. The patient-centered medical home covers adaptation of the fundamental procedures of care, for example, shifting from physician-centric care methods to integrating all affiliates of the healthcare professionals working at their top level of licensure. This model also seats the patient at the focus of the care. Furthermore, it includes constructing care plans to enhance understanding, compliance, improve the cultural and philosophical relevance of care, and better the accessibility and convenience of health care. Five Rivers is governed by a board of directors. Board members are external and hold no shares within the organization. Board members' level of involvement is to evaluate proposed policies, suggest potential community concerns or barriers, and vote on upcoming programs and spending of revenue received from donations. All top management members are the original individuals holding these positions. Five Rivers' top management team is comprised of a Chief Executive Officer, Chief Financial Officer, Chief Medical Officer, Chief Operational Officer, and Human Resources Director. The Chief Executive Officer or CEO is the grant writer, program director, and facilitates joint ventures and policies with the help of the Chief Medical Officer. Administrative management also includes the CEO and CFO. The CEO is responsible for facilitating physician health center relationships and collaborating with Wright State University. The CFO is responsible for overseeing all revenue and expenses for the entire organization. The CFO is required to ensure the billing and coding department is operating in compliance with all federal guidelines with respect to fraudulent billing under coding and all other statutes governed by the Centers for Medicaid and Medicare Services. Many opportunities and threats stem from the natural physical environment. Since Five Rivers treats the underinsured, not insured, and mostly indigent communities, climate changes like snowfall, ice storms, and severe rain can cause surges in level 1 traumas, requiring an increase in patients needing to establish care or follow-up after a surgery or trauma to reduce readmission to the hospital. Many Five Rivers patients are homeless or living in unstable dwellings, and higher than normal temperatures can cause an increase in patient volume from dehydration, heat exhaustion, and heat stroke. The diseases or injuries associated with the changes in climate increase Five Rivers' profitability, but can become taxing on facilities where staffing is short. Federal and state grants are utilized by Five Rivers and are opportunities for more funding, but can become threats if healthcare funding is reduced or changes in grants reduce the amount of monetary awards. Community needs can determine new programs that FRHC may offer, creating opportunities to grow. Changes in employment and local businesses can create opportunities for FRHC to see more patients that are newly unemployed or without jobs. Decline or loss of revenue in joint ventures like Premier Health Partners or Rate State Medical Program would change the way Five Rivers operates and potentially affect its viability. The organization operates as a joint venture with Rate State and Premier Health Partners and additional financial backing through federal and state funding. The structure is not clearly understood by all within the company, and some responsibilities are delegated to other individuals since leaders are often stretched thin. Clinical processes are unorganized due to the extreme growth in a very short time. Employee turnover is abundant, and Five Rivers caters to employees with high years of service. This is both positive and negative, as some of the older nurses are over 75 and have a hard time keeping up with clinical expectations and services. Patients are required to wait long periods of time before being registered due to the shortage of receptionists and scheduling templates that are exactly the same for all physicians at all times. If 14 physicians are on, which is a typical day, each of them starts seeing patients at 8 a.m. The first patient is always a new patient, which takes longer to register. That said, if all patients show up, 14 new patients arrive at 8 a.m. and only 4 registration people are required to register all of them before the next wave of patients at 8:20. SWOT analysis and strategic factors are displayed. The services are expedited in a time-efficient and cost-effective manner. The facilities are conveniently located in areas where locals who are reliant on bus transportation or within walking distance can easily receive care, regardless of any disparities. The organization offers imaging, lab services, radiology, and prescription needs. Weaknesses associated with the medical center include the location, limited services, limited locations, and their inability to become a leading competitor in the Dayton area. The location is not conducive to individuals who live in outlying suburbs. Many people would not choose to have their services there due to wanting to avoid the location. As a standalone medical organization, electronic medical record programs are too costly, and FRHC must purchase Epic EMR rights from Premier Health. There are plenty of opportunities to build an empire and make a name for their organization. The organization can continue to improve the healthcare delivery system in Dayton and could potentially migrate into nearby counties and states. Five Rivers will always have ample opportunities to receive more grants and offer services that cater to the major healthcare concerns in Ohio. Prospects are ample and include offering more specialized services or working closely with the Department of Health and Job and Family Services. After thorough analysis, the clinic flow is directly related to primary factors, which include a lack of training, knowledge, and organizational process. Without a supportive culture geared towards fostering employee education and development, the clinic will lack appropriate unity and process. Without proper education, staff are unable to effectively utilize the provided apparatuses necessary for patient care. The clinic flow will improve with the execution of strategic alternatives. Implement a process of pre-registration where front desk employees can register multiple patients at one time since they are meeting pre-registration guidelines. The process will reduce the time spent in the waiting room and the time it takes for a patient to become ready for clinical employees. Adjusting physician templates. Identify the amount of first, second, and third year physicians, stagger the schedule, and allow staff to have time for each wave of patients. First and foremost, a solution should err on empowerment, and incentives can be offered and encouraged for a competitive advantage to exceed employees' prospects, retain gifted staff, and promote high developing team members. The scorecard shown demonstrates the optimal goal for completing all parts of the strategic plan and process to improve patient flow and redesign the health center would be a 1-year time frame. After 1 year, the health center would see about 10-minute reduction in wait times, an 8% reduction in medication or medical supplies due to waste and error, and an 8% increase in patient satisfaction scores. Quality measures are tools that enumerate healthcare procedures, consequences, and patient acuities, and administrative structure or schemes associated with the capability to offer superior healthcare and relate to one or additional quality goals. Healthcare goals often relate to improving safety, efficiency, effectiveness, patient outcomes, and urgency. Since Five Rivers primarily relies on reimbursements from the Centers for Medicaid and Medicare, standardization of certain quality control measures, benchmarking, incentives, and improvements must be integrated into their core values. Providing employee incentives for meeting certain benchmarks is important to the improvement in the clinic flow and employee retention. Employees must be held accountable for their competency and work at their highest level of credentials. Retention promotes employee satisfaction and trickles into patient care. Any questions?
Yeah, why do you see advancements in technology as a threat?
Due to Five Rivers being a patient-centered medical home and a federally qualified health center, relying on financial gains from grants and other types of funding from the government, mainly, it's hard to get all of the high-tech and innovative technology into the healthcare facility, so it may not look as attractive to patients to come there because they don't have to offer everything that these other medical organizations have that's like cutting edge IT stuff. So I guess that's where I was kind of going with that.
Erica, how can
Yep.
you limit what happens between the patient and the physician during the appointment?
Right now, currently, the residents have the appointment is based off of each person picking 2 items that they want to address. So the appointment is made for a specific issue like hypertension or diabetes. And then if they're a current patient, they get all their medications refilled, but then the patient can pick one thing that they want to address. And then the provider can pick 1 to 2 things that they'd like to address, whether it be preventative health or if someone had a recent test and they want to send them for further testing or something like that, or address other options of care and stuff. So it's just really picking certain topics to focus on during a visit and then following up if there's more topics that need discussed.
Okay, thanks.
Yeah, will cutting appointment time by 15 minutes negatively impact patient satisfaction?
I don't foresee that being an issue, since the cutting that time is really focused on cutting it when it comes to our processes, not when it comes to what the patient is being seen for. So we want to cut the time it takes between stepping into our doors and then registering the patient, which could be 20 minutes waiting to be registered, let alone the registration process taking 20 minutes to register them. You know, patients can be seen in our clinics and be there a total of 2 hours. So trying to reduce the noise of the clinic appointment, not necessarily the meat of it.
Okay, so my strategic audit simulation is over Team Health. Team Health is a national organization that was founded by physicians in 1959. It is a medical provider employer, which means that it employs physicians, physicians' assistants, and nurse practitioners. The main areas of specialty are emergency medicine, post-acute care, and anesthesiology, and they provide these services to customers such as hospitals, nursing homes, urgent care facilities, and anesthesiology offices. Their purpose is to perfect physicians' ability to practice medicine every day in everything they do. And given that there's been a substantial shift to medical provider employers, they should be picking up ground and getting more contracts in the near future. They are currently a privately held facility. They are not publicly traded. Due to an overbid on a buyout of IPC Healthcare, Blackstone Group bought them out and went private, taking Team Health off the market and working to improve the organization so that they could put it back on the market publicly to gain back the investment that they put into it. The current opportunities are competition. There are a variety of different staffing agencies in healthcare right now, although Team Health is not technically a staffing agency, but instead it employs providers and through contracts offers them to the customers they serve. It still promotes innovation and encourages advancement within the healthcare organization. Another opportunity is bundled payment for care improvement initiative. What that is if a physician is caring for a Medicare patient, Medicare will actually give them a lump sum of money to care for that patient. If the patient is released prior to all the money being used, the physician will then be able to pocket the leftover money. However, if the physician keeps the patient in their care beyond what the lump sum was able to cover, then the physician has to then cover the rest of the expenses for care for that patient until they are released. So the goal with that then would be to make sure that Medicare costs are down and that patients are being cared for adequately. But it can also be a source of generation of revenue for Team Health, so that's why it would be an opportunity. Threats, although competition can promote innovation, with more organizations similar to Team Health entering the healthcare industry and market, that could eventually lead to customer loss for Team Health. In that situation, it would be a threat, and Medicare regulations are constantly being developed or revised, and compliance is a necessity to avoid fines and penalties for any healthcare organization, including Team Health. So it is essential for them to maintain compliance to avoid fines and penalties. So that is why Medicare regulations would be a threat. Internal factors, the strengths of Team Health are centralized control, which creates uniformity across all regional offices, including headquarters. It allows for all processes and procedures to be standardized and followed the same from the West Coast to the East Coast, essentially. and 20 plus years of experience in the business also allows them to be able to take advantage of opportunities more efficiently and avoid threats as well. Weaknesses also involve centralized control because it creates rigidity. It takes a lot of the flexibility away from the regional offices, which could ultimately hinder their performance if headquarters does not respond in a rapid manner. And of course, physician burnout is always a concern. Fortunately, Team Health is an organization that does not have to worry about it as much because they've resolved that problem for hospitals and other medical facilities by providing a vast array of physicians or nurse practitioners or physician assistants. So that's not really as big of a concern, but it's still something to keep an eye on. And this is the SWOT analysis. I essentially put all of the internal and external factors into this. So it's nice, neat, and organized and easy to understand there. The external factors were analyzed and rated based upon Team Health and what I believe would be the best opportunities and the greatest threats. It does seem that BPCI would be the greatest opportunity and that Medicare regulations would probably be the greatest threat. Internal factor analysis summary. The greatest strength would be their experience in the business. Again, it is more of a kind of a niche that not a lot of other organizations have specifically tapped into. So with their experience with being a medical provider employer, they could use that to their advantage. And centralized control as a source of rigidity would be a weakness that would probably trump physician burnout for Team Health. Putting it all into the strategic factor analysis summary, the highest rated thing on this would be the Medicare regulations, and then the strength of 20 years of business would be the second highest rated. BPCI I put as an intermediate duration because it could become obsolete if it's something that the government doesn't see as being viable. Medicare regulations are always going to be a concern and something to look out for, so I put that as a long duration. 20 years of experience, you can only build on experience, so of course that would be long as well. And centralized control I put as intermediate because they could end up decentralizing or they could maintain it. Just uncertain at this time. And then I did the TOES matrix and developed 4 strategies based upon combining or pairing up strengths and weaknesses with opportunities and threats. And the 4 strategies are: use the organization's efficient patient care practice to capitalize on initiatives while continuing to provide exceptional care. Allow regional offices to determine whether it will be advantageous to use this initiative to generate additional revenue. Utilize expertise of seasoned employees and efficient practices to effectively recognize new regulations and implement compliance. And finally, decentralize control to allow regional offices to better manage state-specific Medicare regulations. Regard to implementation of bundled care or bundled payment for care improvement initiative, the individuals that would be in charge of that would be middle management, working in correspondence with regional office management. The budget for that, since it is a marginal expense compared to other programs, would be $500,000. The time frame for that for implementation would be 6 months, and it would be considered a Six Sigma program type because it's company focused and frequent assessment of revenue generation to determine whether or not this initiative should be continued. In regards to Medicare regulation, the individuals in charge would be middle management and the managers and HR representatives that are broken up into 4 teams to be compliance officers for the national Medicare regulations. For state specific, it would be regional office management. The budget for both of these would be $3 million total, and that again would include the national and statewide initiatives. Time frame for both would be 15 to 21 months, And both programs would be total quality management programs because they are customer focused and concentrate on regulation compliance. Controls, the best controls to put into place to avoid any kind of fraudulent information being put into the system or sent back to headquarters regarding these would be to reward objectives that are met instead of focus heavily on punishment. If someone feels that they're going to be rewarded instead of punished, they're more likely to provide the correct numbers instead of fudge the numbers in regards to the initiatives here. Evaluations, I said that information systems would probably be best. There would be a regulations compliance information system to put into place, similar to a LexisNexis Compliance 360 program that I found information on, that just provides updated regulations in regards to Medicare and looks for, just assures compliance by use of comparing records, medical records, to coding that's sent out. And then accounting and information systems would be put into place to determine whether the BPCI is generating revenue for regional offices or if it is not. And then the balance scorecards, I developed a balance scorecard for the Medicare regulations. For providers, it would require Medicare regulations training every 6 months to ensure 100% compliance. Customers and stakeholders, it would require regional offices to assemble a knowledgeable and skilled team to provide to customers within 1 year. Patients, provide the very best care while ensuring 100% compliance of new and revised regulations. And financial, reduce fines and legal fees related to non-compliance by 20% in the year span, in a 1 year span after implementation. For BPCI, providers, it would complete 100% BPCI training within 6 to 9 months of implementation of the strategic initiative. Customer shareholders, increase patient care efficiency by 50% within 1 year to ensure revenue generation of BPCI. Patients, develop efficient patient care practices within 1 year to ensure superior patient care while allowing for revenue generation. And finally, financial, increase BPCI revenue company-wide by 10% within 2 years. Are there any questions?
How do you see motivating providers to complete the BPCI training?
To encourage providers to complete the BPCI training, basically just indicate to them that if they complete the training and they follow efficient practices and end up generating revenue for the organization, there's a high likelihood that they would receive some sort of profit sharing or bonus for generating that revenue for their regional office.
Catherine, what exactly does BCMI mean, and what does it mean for providers, and how will that improve, like, the financial status of the organization?
So BPCI stands for Bundled Payment for Care Improvement. And essentially what that means is if, like I said, if a physician's caring for a Medicare patient, they are offered a bundled payment or a lump sum of money to care for that patient based on their diagnosis and treatment plan that's set forward for that patient. And the way that they're going to use it to generate revenue is by developing efficient practices for patient care that still offer superior patient care for the patient and make sure that they're treated, to the highest standards, but at the same time doing it efficiently to where they're not remaining in the hospital for a prolonged period of time, in the hopes that the money is not used up entirely for the patient and they're released prior to all that money being used. It's not necessarily providing inadequate care, it's just finding ways to maintain efficiency when providing care so that the money can end up, any leftover money can be pocketed and generate revenue for Team Health.
Awesome. Thank you.
Catherine, in regards to the Medicare regulations, how are you going to hold your providers accountable for compliance?
For that, I would say that we're going to use a compliance information systems software system to where, the system will be set up specifically to monitor physician activity in regards to the records they're keeping for their patients and what they're billing out for their patient care of the same patient. Just kind of comparing those two against each other and just seeing if anything looks off, if anything looks like it's being undercoded, overcoded, if there's any fraudulent activity. And in the event that there is, then the physician in question, there would be further investigation. They would be held accountable in the event that they are, if there's non-compliance.
Okay.
So, yeah.
Thank you.
Mm-hmm.